Hello, my name is Kira Duggan, and I did my presentation on corticosteroids and their effects on respiratory issues. By the end of this presentation, I hope that everyone will have a basic understanding as to how corticosteroids work in the body, the side effects, and the basic nursing considerations. I want to first apologize for the high amount of words on these slides. I personally learn better by reading information rather than speaking it or listening to it, so I figured I would try to include all the information on the slides for people who learn in similar ways. Corticosteroids occur naturally in the body, and they can also be made synthetically. Their job is to suppress the immune system, therefore limiting inflammation. They can be used to treat asthma, COPD, colitis, arthritis, dermatitis, and other inflammatory issues. There are a few different kinds of corticosteroids. The most common is glucocorticoids, which includes prednisone, methylprednisone, and dexamethasone. Budesonide is a synthetic form of a glucocorticoid. We will be taking a closer look at two examples. One is a glucocorticoid and the other is a synthetic glucocorticoid. The first one is prednisone and the second is budesonide. We will be looking at how they affect the lungs. Prednisone is typically taken as a tablet and prescribed for treatment of inflammation in the lungs, such as asthma or COPD. Budesonide is typically taken as an inhaler or nebulizer and is prescribed to prevent the symptoms of asthma. So to begin, we will start with pharmacokinetics. Prednisone is well absorbed orally and distributed through the body by binding to albumin and corticosteroid binding globulin. It is metabolized in the liver through phase 1 and phase 2 reactions. Its half-life in the plasma is about 3 hours, and its duration is about a day to a day and a half. It is excreted through urine and bile, so in other words, the feces. Budesonide is not as well absorbed, and its availability is only 39%. It is directly absorbed through the lungs and enters the circulatory system. It is metabolized in the liver by the CYP3A4 enzyme. Its half-life is about 3 hours, and the duration is about 12 hours. It is excreted through the urine and feces. Next, we will talk about pharmacodynamics. Prednisone works by suppressing the body's immune system, which then inhibits the inflammation of the lungs. It does this by entering the cell into the nucleus and inhibits cytokine production, which then decreases the number of circulating lymphocytes. Budesonide works by suppressing the activity of inflammatory cells in the airway. It does this by activating glucocorticoids receptors in the bronchial cells, which then prevents bronchoconstriction. Next, we will talk about pharmacotherapeutics, first with prednisone. Prednisone should not be taken with active infections, as it impairs the body's immune system, and it should be used in caution with chronic treatment. It should be used for the shortest time possible, as well as with caution in pediatrics and patients with potential infections. There are a lot of serious side effects that come with prednisone, or any steroid for that matter, especially for when the patient is using these drugs for a long period of time. The most common include acne, weight gain, nausea, vomiting, and anxiety. The most severe include cardiac ischemia, pulmonary embolism, and hypokalemia. Thiazide and thup diuretics stimulate metabolism, and oral contraceptives decrease metabolism, and NSAIDs increase stomach upset. Now on to budesonide, pharmacotherapeutics. This drug is contraindicated in acute asthma attacks and should be used cautiously in diabetics, people with glaucoma, and people who are immunosuppressed. The side effects of this drug are less severe than prednisone. They include rashes, inflammation of the sinuses, throat and nose, adrenal suppression, abdominal pain, nausea, back pain, and tremors. For drug interactions, CYP3A4 inhibitors will decrease metabolism. Finally, we get to clinical use. As I said before, prednisone is used to decrease inflammation and mucus production in the lungs, and is usually for short-term care, such as flare-ups of asthma. There are now studies showing that prednisone may be useful in the treatment of COVID-19. It is taken by mouth and once taken, the nurse should monitor for signs of adrenal insufficiency, peripheral edema, adverse lung sounds, and dyspnea. It is also important to monitor for signs of psychological issues such as anxiety, depression, or body image issues. Budesonide is used to prevent inflammation in the lungs, and so it can be administered with an inhaler or nebulizer. It is important as a nurse to know how to use the inhaler and nebulizer. After administration, it is important to monitor the patient for signs of adrenal insufficiency, adverse lung sounds, and withdrawal symptoms, which include severe fatigue, weakness, body aches, joint pain, and nausea. Patient education is very important for steroids. It is important to teach them to take their medication exactly as directed by their healthcare professional. They should avoid people with contagious diseases. It is also a good idea for them to carry around a warning card that indicates the use of corticosteroids, because in the case of a respiratory emergency, the use of bronchodilators alone may not be enough, and they may have to begin with a steroid treatment as soon as possible to see improvement. And for prednisone, they should contact their PCP if they experience any of the symptoms on the slide here. They should eat a diet high in protein, calcium, potassium, low in sodium, and low in carbs. As I said on the last slide, this drug may cause weight gain, so it is important to address body image issues with your patient and talk about coping skills. With budesonide, it is really important to teach the patient how to use the inhaler properly, and if they are taking a bronchodilator as well, it is important to use the bronchodilator first, wait 5 minutes, and then take the steroid inhaler. After using the inhaler, it is important to rinse out their mouths. Finally, we will talk about bronchodilators versus corticosteroids. In many cases, these drugs will be prescribed together. The bronchodilator will open up the lungs, which enhances the function of the steroids. Thank you for following along with this presentation, and I hope you learned something about corticosteroids and their use on the respiratory system.